We've been voted best medical spa of Essex County, and we really take pride in that accomplishment. So it's a natural extension of our surgery here at Spiroplastic Surgery and the non-surgical fillers and Botox we do. We offer the latest in comprehensive skincare management with peels, and not only that, we've extended that. We're constantly in search of the latest products and procedures that will enhance patient outcomes while decreasing downtimes. So whether it's laser resurfacing, hydrofacial management, we have your solution.
Gonna move the mountain, gonna touch the sky, stand in the middle of a hurricane, looking right in the eye. Ain't nothing gonna hold me down. Get ready, 'cause here I come.
Often asked the question, where does Botox work best? So Botox is really used primarily for the management of facial lines, but is also used for what's called hyperhidrosis or excessive sweating. So Botox used for facial lines is typically used, you could think of it as three important places in the face. In the upper half of the face or upper third of the face primarily, and it's for lines between the eyes, which we call corrugator and procerus muscle, for the transverse lines, the horizontal lines that etch across the forehead, and for the crow's feet area. So Botox works by, called a neuromodulator, it modulates the end plate, the nerve end plate, and how it affects the muscle action. So Botox typically lasts in these areas for anywhere from as little as 3+ months to as much as 6 to 9 months in some patients. For hyperhidrosis or excessive sweating, the most classical location for injection would be armpits. And for armpit excessive sweating management, Botox injection can last for as little as 3 to 6 months, but I've had success with patients who say it's lasted for upwards of a year. Those are the most common places that patients ask for Botox. When you're ready. Hi, Dr. Spiro of Spiroplastic Surgery. We have one of our patients here, and we're going to be doing a live Botox injection on our patient. So thank you for helping us out. Botox is used very commonly to treat the wrinkles and lines in the upper third of the face. So we're going to show you how simple of a procedure this is to do. So we have our patient just rest her head back, and we usually just start in the center. So we're going to be pinching in a couple little spots. You're going to see how little discomfort, if any, the patient has. And the whole procedure takes just seconds or minutes to perform, and then the Botox works its magic. So the way my technique that I use utilizes very few injection points, but as a plastic surgeon, I know the anatomy from having seen it in the operating room so frequently that I can visualize without seeing it where we need to be. Little pinch, little pinch, little pinch, little pinch. For the purposes of our injections today, we don't have our music on, but we usually will serenade the patient with some of our soothing skincare music selections. We're going to be moving away from the forehead and in the lower portion and treating now the upper portion. The patient has described for me what she wants treated the most, and we're going after those points individually. A little pinch and a little pinch. Doing okay?
Yeah, I'm good.
Great. We're about halfway done. Just raise your forehead for me. Good. Relax. Little pinch. It usually takes only about a day to a couple of days for Botox to really take effect in the patients who've had Botox treatments in the past. For those that have never had Botox, it sometimes will take a tiny bit longer. We're almost done. Now we're going to be going over to one of the areas that the patients are most happy to be treated, and that's the crow's feet area. So, are we ready? Good.
Ready.
Doing okay?
Yep.
Great. I'm going to have you squint, relax, just a couple of little pinches. Pinch, pinch, and pinch. Great. I'm going to be coming around to the other side, and we're going to do our other location. Squint again. Great. Mary Beth, you have some little saline to pinch, 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 pinch. Doing good?
Yeah.
Great. We are almost done. And then we will finish by giving her a little bit of ice. I'm going to do the nose now. So wrinkle your nose. We call those the bunny lines. Relax. Close your eyes. Little pinch. Little pinch. All these little bumps and dots go away within an hour. Doing okay?
Mm-hmm.
Great. Just a little pinch. Relax. Last little one. And we're all finished.
Bellis Medical proudly introduces the SkinPen SkinFuse system. As we grow older, the architecture of our skin naturally deteriorates, leading to fine lines and wrinkles. SkinPen uses the body's natural wound healing response to give skin a more youthful, healthy glow, delivering thousands of isolated micro-injuries. In response to the procedure, the body initiates its wound healing process. The body then immediately begins to break down damaged tissue and release cell signaling molecules. Production of healthy cells increases. These cells begin to repair and remodel the injured tissue, producing organized, healthy dermal tissue proteins such as collagen and elastin. Over time, your skin works to remodel the treated area with new tissue and blood vessels, thickening the epidermis and giving the skin a lifted shrink wrap effect, restoring a youthful, healthy glow with little to no downtime.
The beauty of cool sculpting is that it can remove and reduce fat volume in a patient without the need of surgery. So we have a dedicated suite for cool sculpting here at Spiroplastic Surgery that allows a patient to spend anywhere from 1 to 4 hours at a setting without any downtime, no garments, and no surgery. And that allows patients even to go to the gym that night after a fat reduction procedure.
We are proud to offer Cool Sculpting in our practice. Cool Sculpting is the world's leading non-invasive fat reduction treatment, with millions of treatments performed worldwide. The New York Times says the leading procedure in the non-invasive body contouring category is called Cool Sculpting. New Beauty magazine readers voted Cool Sculpting tops for treating fat pockets and freezing them away. You may be wondering if Cool Sculpting is right for you. Ask your clinician for a Cool Sculpting consultation today. Mirrors. They show us all our problem areas, those places where we carry excess fat. Perhaps you've noticed that your clothes don't fit the way they used to. Or maybe you've been working out but still can't seem to lose that stubborn fat. Cool Sculpting targets and eliminates fat in problem areas such as your abdomen, flanks, and thighs. You can reduce that excess fat under your chin, eliminate unwanted back fat and bra fat. And now, thanks to the latest Cool Sculpting technology, reduce fat on your upper arms. Love what you see when you look in the mirror. Ask your clinician about Cool Sculpting today.
I'm Lainey.
I'm Jennifer. Jen.
You go first.
No, it's your story.
Okay. In March 2018, I was diagnosed with bilateral breast cancer. In the summer, August, I guess, while trying to find closure, I started thinking creatively.
We started writing a story about a couple.
We realized that the weight of such a traumatic,
Crazy,
intense experience was too significant to ignore. Ensuite tracks a woman's journey a year after breast cancer surgery and how that singular event informs a marriage.
The cast includes Ensuite's brilliant creator and talented actress, Lainey Ventura, and the equally wonderful Robert Bogue as Mr.
I reached out to my friend, Jeffrey Cantor, to direct.
With your help, we can make this important, timely,
Profoundly personal project a reality.
indeed.
So the Breast Cancer Walk for the American Cancer Society, Making Strides, is incredibly meaningful because that's what our office was built upon, was taking care of breast cancer patients, trying to bring their lives whole together. And it really is very powerful and especially meaningful to me when our patients join and our OR nurses join and the hospital staff joins. It's just a great, amazing event.
We are